Without question, air quality and emissions of particulates in the state of Maine is a major problem. And yes, we have acid rain and other issues of air quality that are coming from the rest of the nation, but right here in our state, I grew up in Oxford County. And Oxford County, Maine, is in the top 10% of all counties in the nation in terms of the risk at which people are exposed to for particulate emissions. These are serious, serious issues. I'm a private business person. I work with engineering firms. I work with cutting-edge technologies that innovate solutions to these types of problems. And yes, they're a cost. We need to take a hard and serious look at the cost now so we can avoid these life-threatening costs down the road. Also, in this instance, it would be unwise of me not to bring into this conversation water quality, and I'm talking about private wells out there. I am a Maine state licensed public water systems operator. I took that task on as a result of a need in our community. It's not something I woke up in the morning and wanted to do, but I've learned a lot. And we have serious issues with lung cancer in the state of Maine. 1,000 people are diagnosed with lung cancer in this state every year. Tobacco plays a huge part of that, we know that, but radon is also a factor. And radon in groundwater is a serious, serious threat. I will seek to be, and I will be, a champion for getting these issues out into our public. A governor is an executive. An executive needs to be a communicator, not sitting around in a room and discussing policy with legislative leaders and lobbyists, but getting out in the public. Awareness and education are key. We can solve these difficult problems, and that's what I'll do, is I'll take that approach.
Well, going last is sometimes a little difficult when you get a lot of great perspectives, and they certainly raised a lot of important topics. Our company has been recognized by the DEP. We joined the Governor's Carbon Challenge. We've reduced our carbon footprint by 30%. We've switched over to waterborne paints. We've been an environmental leader. We're certainly in an industry which is toxic, and we've done a lot in personal hygiene and safety to make sure that we take care of our folks in the work environment. I want to add a different perspective. When we talk about the environment, let's talk about the environment, the social environment, the economic environment. The environment is all-inclusive. And right now, Maine's struggling and suffering from an economic slowdown and downturn that's creating a lot of levels of stress and anxiety in our families. And you think about you folks dealing with your patient core groups every day, a lot of that can be traced right back to that increased level of stress and anxiety, which leads to abuse, substance abuse, eating disorders, smoking. There's a common denominator there. So we need to focus on reigniting the entrepreneurial spirit of this state and get our economy back going again and growing again. That's crucial to Maine's economy and to Maine's health going forward. So the environment isn't always the ecosystem, because in large part what affects you folks dramatically and individually is the stress and anxiety that society's suffering from right now for a couple of years of really tough economic times. We've got to grow our way out of that by reigniting our business community in the state of Maine and allowing us to become vibrant again as a people. We've become stagnant. Thank you.
Mayor LePage, the fourth question comes to you to start. What is your plan to attract general surgeons, psychiatrists, and primary care physicians sorely needed to the rural areas in Maine?
The best and most effective way is to take people who are born and brought up in rural Maine and educate them to become doctors. I'm a big, big proponent of the University of New England. At the same token, we need, I've seen in recent years that we go to the big cities, we bring in doctors, we pay off their student loans, we keep them for 3 years and they hightail it. I think that we need to do a better job in looking for those docs that have been trained in the, that come from rural areas and been trained, and that we have a chance of keeping them here if they can appreciate and enjoy what Maine has to offer. But in the long term, we need a very strong and powerful medical school here in the state of Maine.
I stand as witness to how you can recruit psychiatrists to the state of Maine. Yeah, I need one. In 1974, Melanie and I, when Melanie was a lawyer, we tried to come back to the state of Maine, and we couldn't because the Portland law firms weren't hiring lawyers. It took 25 years. Melanie quit practicing law, went to medical school, and found a residency at Maine Medical Center, and 25 years later, in 1999, we were able to move home to Maine. Now, I don't commend that as a general approach to recruiting, but I want to tell you that I appreciate more than anyone all of the residency programs in the state of Maine, and not just the Maine Health Tufts Partnership, not just all of the University of New England's wonderful programs, and Paul's absolutely right about them, but also the family practice residencies at Eastern Maine, at Central Maine, at Maine General, and all of the residencies at Maine Health, at Maine Med. I think there's one other point that needs to be made beyond the scholarship point and recruiting point that Paul mentioned, which is important. And that is this. I think we need to create in Maine an environment for practice, for the medical practice, that is welcoming and open to medical students like my daughter, Abby, wherever she is, who's now at the University of Chicago Medical School, that welcomes them back to Maine into practices, into accountable care organizations, into tiered systems of health care that make sense to them, where they have access from rural areas to really good technology and really good specialized care. That's what we need to do, and when we create that environment in the state of Maine, we are going to see people flocking here.
Without question, national policy on healthcare is driving a lot of cost, directing how and where we practice, who does the paying. But there is one thing we can do right here in the state of Maine. It's a monumental task. Somebody has to step up to the plate, and I'm here to tell you that medical liability insurance and tort reform need to become priorities to move this state of Maine in a direction where younger people, new physicians, can come to our state and have a competitive advantage. Dean Hahn of the University of New England School is here somewhere in the audience, and I know that I met with the doctors of osteopath down in Portland back in January, which seems like 100 years ago. And you know, his home state of Texas has moved forward on tort reform and looking at these issues. We are creating an environment in this state where it's getting to be unreasonably burdensome for practitioners with this issue. This is a key issue. It's not the one, but it's something we can do right here in our state to start addressing solutions. I'll say this, my experience with venture capital funding and technology startups has taught me a couple of different things. One, the best business model is one that operates in an existing marketplace, and I think healthcare is an existing marketplace. Number two, whenever you begin to make a new or innovative change and you're the first to the marketplace with that change, that's a recipe for success and profits. We can move forward with innovative ways to initiate bringing young people, existing experienced physicians to this state. Tort reform, liability reform is a big piece, and if we can get out in front and lead on that piece alone, we can start creating and cultivating an environment. We need to cultivate environments that are productive and solution-oriented. That's what I represent in this contest.
I think one of the crucial things that we need to do, and we were at the agricultural committee there, the AgCom, and it's just a shared thread across Maine, whether you're farming, you're fishing, you're logging, or in your medical practice. It's got to be profitable. It's got to be profitable for people to seek out that opportunity. You know, how do we make it profitable? We've got to look at, we'll start with the state. The state needs to start paying their bills. That's first and foremost, paying their bills on time. You know, when the hospitals get reimbursed, you folks get reimbursed, you can reinvest that capital. Mercy just built a clinic out there in Gorham. I don't know what you say, Gorham's completely rural, but that model, when you build that facility, the cost of delivery drops dramatically because you're not at the emergency room. And guess what? If you build a state-of-the-art facility with the right equipment and the right technology, the people come. The doctors will come. The practitioners will come. and service that area. We have 5 facilities. We could have built one big facility in southern Maine, but we chose to reach out to where our customers or where the consumers are. And that's the same approach that the medical field has begun practicing. It makes perfect sense. We also need to hold the line on Maine Care reimbursements. You know, they've cut that. A lot of budget cuts looming. Is that going to get cut even deeper? You know, we've had 30 years of dealing with insurance companies. Not to make light of working with people is different than working on vehicles, but the payment process and the paper flow and all the bureaucracy that goes with that, we understand very well. And we need to make it profitable. And the relationship that we have with Peter Bates has done at the Tufts University, we need to accelerate that and promote it. That works, and that's exciting. We need to expand that. Thank you.
Thank you. The theme of your event today about transitions, I would also add to it best practices. Kudos to all of you, frankly, for practicing in Maine. We're very glad that you're here. Secondly, to the University of New England, who's found the key to this many years ago about offering preceptorships and giving young people an opportunity to grow and work with their colleagues across Maine. I had the privilege of going to the opening lunch of that very first medical recruitment group to Tufts and Southern Maine Medical Center. And when the kids were there were 32 of them, 30 of them were from rural Maine. They wanted to come home to practice. So those are 2 outstanding programs that progress is being made in. We're behind in dental care, and I must say, when my husband and I came here in 1971, so many of my neighbors could not smile. They would always cover their mouths because the dental problems were so severe. And I hear those who work in nursing homes talk about the terrible lack of access to dental care for our aging citizens, and there are a lot of those in this state. But if the voters of Maine approve, again, the University of New England, leading the way, is trying to open a dental school so that we can have more people practicing. But as I think about all of these things, no single one is a silver bullet, we all know that, but I serve on the board of a hospital too, and we've been trying to merge 2 hospitals in Augusta and Waterville. But the cancer center there was so enlightening because we knew we needed a critical mass so that doctors could have some time off. So that if we had enough doctors in one place, they didn't have to be on call every single day because that is not humane. The final thing is, frankly, the quality of life here in Maine. A good education system, a good environment, and a good workplace will bring doctors to Maine because they care.